welcome everybody. Good afternoon for most people and good morning for others. And Eid Mubarak to those of our community who are beginning the month. Good luck to everybody. I'm absolutely delighted to see so many people who are interested in the Supply Chain Excellence, the African Supply Chain Excellence Awards. It's something very close to my heart, having been involved from the sort of conception of it to the end result, which resulted in organizations like Sharmane's and the efforts being done by supply chain practitioners like Sharmane being recognized and applauded. I think a lot of you, particularly those of you who work in the public health space, will know that sometimes it's a bit of a thankless task. You have to work exceptionally hard just to keep simple things going. And at the end of the day, yours is a role whereby people are the ones who either suffer or benefit from the efficiency of supply chains. So it was a great delight to be able to award Sharmane and her team with the Sustainable Supply Chain Award last year. And I'm really excited to be able to showcase this. And thank you so much, Sharmane, for volunteering to do it for us. I think it's great to be able to provide a platform for this sort of work. And Sharmane is a supply chain practitioner with over 20 years of experience, most of which is in public service. This story is particularly around the Western Cape Government Hospital in George that went through a process to, and is still going through that process, to achieve sustainable procurement process and how to become green. And we all know, sustainability is a word that's bandied about so much at the moment, but we've all got to do our bit. We've all got to try to protect the environment, to protect our countries. And it starts with us as individuals. But when you can get an organization such as the Western Cape Government Hospital in George taking this mission seriously and having somebody like Sharmane drive it through to a successful, I won't say conclusion, but a successful base on which to build is super exciting. So I'm very excited to welcome Sharmane to share this with you. What I would like to encourage you to do is, while you are listening to this story, think about your own work on the continent and in your country or wherever you have done work in supply chain and where there has been an excellent outcome or it is demonstrating supply chain excellence, and put a submission in. Claire's popped the website address into the chat. Don't underestimate what is excellence and don't underestimate what it is that you do that is excellent. So think about the work you're doing, think about the projects you have been involved in or your organization has been involved in that you really want us to know about. We're interested in everything, so share with us. So leading by example, Sharmane, I would really like to welcome you to share your story with us so that we can learn and we can applaud supply chain excellence.
Thank you, Jenny. Good afternoon or good morning to colleagues all around the world. And Jenny, thank you very much for the warm introduction as well. As the winner of the Africa Supply Chain Excellence Awards in the category Sustainable Supply Chain, I'm humbled to share my journey with all of you and take you through the process of what we've been through in the Department of Health. My presentation focuses on sustainable procurement as well as tracing the carbon footprint while I was at George Hospital. I'm still within the Department of Health and Wellness in the Western Cape, but I have just relocated and moved on to another hospital at Red Cross Children's Hospital in Cape Town, and whereby I'm aiming to implement and continue my sustainable journey, as this is one of my passions as well. So even though I'm not at George Hospital now, the process still continues at George Hospital. And I'm also giving insights and inputs as that journey continues. And I aim to take a new journey now at my new hospital here. So I'm just going to go through that. I will just give you an overview and a background of George Hospital and our journey with regard to sustainable procurement and how we link this to the objectives and the hospital strategy. We went through to change the hospital strategy to align it to sustainability. Our stakeholder engagement, what we've achieved to date, and what were the financial implications to that, and align that to the regulatory framework within the National Treasury and Provincial Treasury within the Western Cape. And then just share some lessons learned and a little bit on tracing the carbon footprint within supply chain, what the impact is on the environment, and then finally going forward and what is our way forward with regard to this. So the Western Cape in South Africa, George Hospital is based in George on the Garden Route. It's largely a rural area and it services the Garden Route in Central Karoo with about a population of 650,000. It's a regional hospital with majority of the tertiary services that are also conducted at the hospital due to its location. It's about 500 kilometers away from Cape Town. And it's a public health facility within the Western Cape government. So it's a 280-bed regional hospital and with the staff complement of 800. And on a monthly basis, I've just put in the stats there to give you colleagues an idea of what the hospital does. And so we look at, they were looking at about 1,700 inpatients, and on a daily basis, and on a monthly basis, 4,000 emergency cases coming through the emergency and trauma unit, and outpatients department, various clinics, 5,400 patients a month, and then also, they do a lot of extensive outreach programs to the smaller rural towns within the Garden Route. And I think George Hospital, we positioned ourselves as one of the leaders in health systems within the rural area by responding to climate change and providing a more sustainable healthcare service. And through action and by leading by example, we made a commitment to implement measures in the hospital to reduce the hospital's environmental footprint. So my journey started just by coincidence, actually. And I was just landed in the deep end where I had a request from the supply chain director at the Department of Health. She was supposed to do a presentation in Sandton and she could not make it. And then I was just asked to fill in for her with her presentation. And believe me, I knew nothing of what was happening. And on the day of the workshop, the presentation didn't arrive. So I just had to speak freely for it. And after that workshop and things like that, the result was that this created a deep awareness in me. And I was inspired to explore this within the public sector. And because this was something relatively new. From the workshop, there were a lot of public hospitals that have engaged and started the journey, but there were nobody within the Western Cape that was looking at this. I also saw the workshop as a networking opportunity with the hospitals in the other provinces that had started their sustainable journey, and also the knowledge and the role that procurement practitioners can have and can contribute to this. And this motivated me to start something local, and so began the journey at George Hospital on sustainability. We had to then go and look at our strategic objectives for the hospital, because none of the objectives spoke to responsible healthcare and environmentally responsible healthcare. And then one of our strategic priorities, priority number 4, changed to become the leader in environmentally responsible healthcare. And then we aligned this to the UNDP with regard to the products and services we buy should be as sustainable as possible. And George Hospital then has now been in the forefront of embracing environmentally safety products and processes throughout the Western Cape. And we believe that we are the key to change when it comes to reducing our environmental footprint without compromising quality of care for our patients, and as well as cost-saving initiatives as well. We also then decided that we needed to develop a culture of learning and innovation whereby the staff can continuously seek and apply new knowledge to inspire the individuals within other hospitals as well. And then in order to do that, we needed to take meaningful action and then to build strong partnerships as well within the community and within our healthcare system as well and such. We also had George Hospital since 2016. We have been a member of the Global Green and Healthy Hospital Networks as well. And in line with that, we aligned our processes to the SHIP objectives, the Sustainable Health in Procurement project, which abbreviated the SHIP. Whereby they have 4 key objectives, and these objectives came from the Global Green and Healthy Hospitals. And in incorporating into SHIP, we started looking at the sustainable procurement strategies and the policies and the plans that the hospital will have. And then to start looking at compiling a high impact procurement list. And what are the sustainability concerns, especially when it came to the contracts and tenders, because the rules and regulations and the policies of the department are very, very rigid as well. And then training of our procurement specialists, including our clinicians and our nursing staff as well, and just in order to strengthen the capacity at the hospital as well. And then finally, then we look at the tracking and monitoring, the collating of data, and then the tracking and monitoring in order to prepare a sustainability procurement report on this to share with others as well. So the regulatory framework, so you will see it on my slide presentation, I put it in red, because you will see that the framework is quite rigid, and the acts and the policies as well, they often seen as barriers and red tapes. In order for us, it will be it proved very difficult for us to go and change specifications and to incorporate sustainability right in the beginning. And that's how we came about to drawing up standard operating procedures first, and then to start looking at our specifications. And we noticed that nowhere in the Western Cape did any of our specifications for any consumable or medical and surgical, as well as cleaning products, hygiene products, as well as any supply chain consumable, it did not incorporate any sustainability of it. So that was the step for us to start to look at. So the PFMA Act, this is the Public Finance Management Act of 1999, which we are governed by the state. It clearly outlines that the procurement processes the principles need to be fair, it needs to be equitable, it needs to be transparent, competitive, and cost effective. So aligning this to the sustainability part, we had to ask the question, especially when it came to cost effectiveness, would sustainability, incorporating sustainability, will it cost us more, or will it be cost effective? And also the transparency and competitiveness, will we be now eliminating potential suppliers if they did not have packaging, etc., that were not environmentally friendly? So just a little bit on the regulatory framework as well. The objectives of the Public Finance Management Act is to identify the sustainable practices, and then understanding the regulatory framework will ensure that we have correct market research, and sharing all our specifications and benchmarking it with other institutions, and also helping suppliers to understand what we were looking for, because that was okay, because I think we believe that the suppliers, they are the experts with it, they know the product, and bringing them on board will definitely assist us with this. And I felt that it was our responsibility as procurement specialists to build a more resilient supply chain team as well, to go through the adaptations of specifications. It requires change management as well, and reprocessing and remanufacturing, and because in many instances, you will find that our clinicians and our nursing colleagues, they are used to consumables that are come in a specific package, how they looked at, and they were familiar with it. And suddenly bringing in a new product with a different kind of packaging and stuff needed a totally different mindset as well. So together with the Public Finance Management Act, we had to go look at the financial impact of it as well. What would this align to as well? So the state's resources and the funding is very, very limited as well. And our goods and services budget, which incorporates all the consumables and everything that is required to run a hospital, we only had 151 million rand for the hospital. And then we had to go and identify the sustainable practices that could help save costs as well in line with the budget. And the financial climate when we went on board in 2020 had serious repercussions for us, because there were serious budget cuts within our budget as well from the department. And it was certainly a learning curve for all of us, and we learned to do more with what we had, or even with what lesser than what we. So it was taking the lesson to the clinicians, to the nursing, that the reality with the budget cuts is that we would have to do more with less. And then the impact of the pandemic as well brought about its own challenges as well to us, because while we're going through this journey, undertaking the sustainability part of it, suddenly we were faced with the pandemic, and we needed to get consumables, and we needed disposable consumables. We needed to look at the protective equipment and what would be the cost of this, and the impact that this was going to have on the landfill as well. And then finally, further down line, you will look at we had to look at the total cost of ownership growth. But then we realized that we had to look at the cost of what would be the cost of not acting. Even though we're going through a pandemic and we started the journey of incorporating sustainability, what would it mean if we don't act at all? We then decided to look at, while going on this process, we started to look at our stakeholder engagement. If we're going to start something new, who do we look to and who do we turn to? So the first and foremost is that we had to engage with our community, and most importantly, our patients. And one of the things that we did was that we started at our admissions, in the main admissions reception areas. We started in our OPD clinics, in our outreach program, to engage with our patients, to get the feel of it. What would they think about it? Because ultimately, the message that we brought across was that if the hospital looks at the environmental impact and what we're doing, it will definitely have an impact on the community and on the patients, and this will have a direct link to the patient's health as well. And then we also I had to engage with the procurement practitioners at the hospital as well, because this was about change management, changing their mind and trying to explain to the team, why do we need to do this? Why we need to change this, and getting their buy-in and bringing them along. The next step was that to begin a conversation with our suppliers and manufacturers on sustainability, why it matters and what we can do about it, but hand in hand with our suppliers and the direct manufacturers of it. We then had to we went in to look at the hospital management to get buy-in from the executive management, which I was part of, and then as well as the operational managers as well. And then engaging with the end users at George Hospital, the clinicians, the nurses, the support services, the facility management, and including HR management as well, human resources. And then it became a bigger part of our collective conversations in meetings, and how each of us can change our habits within the hospital. And the executive management was given a task to drive this within the hospital because it was incorporated into our strategic planning as well. And then in order for the team to understand the impact, we used simple examples for the staff at the hospital. We said, look at public transport instead of driving your car to work. As one individual, look at the impact then of of the transport, and each individual driving their car to work, and instead of using public transport, with example, a bus, by supporting local farmers at the farmers market, replacing the lights in their homes with LED lights, and literally recycling anything that you can, and everything would help the institution. And then we were fortunate enough at George Hospital that from the clinicians to the nurses to the support services staff and everything, this was embraced wholeheartedly by everyone within the hospital. Once we got that buy-in and the positiveness from everybody, we then moved on to engage with the Department of Health at head office. This is in the Western Cape, with the health procurement specialist there. So with the chief director and her team, and especially with the clinical sourcing department, to see how best we're going to move forward with sustainable procurement in the department. And I then went on to engage with the Western Cape Department of Environmental Affairs. This is a different government department in the Western Cape, to see, because the Environmental Affairs Department, they came with specialists on this thing. They would be able to tell us what were in the products, whether they were safe, what the products were made of, especially like with the cleaning products, the hygiene, and what its impact would be on the environment and their packaging as well. And we had a lot of support coming from the Global Green and Healthy Hospital, as well as Healthcare with No Harm, which we have been journeying on within South Africa as well. So the aim was to then look at what create the best practices within the Department of Health, what we have done so far, and then to take the best practices and share this within all the hospitals in the Western Cape. Within the department, then we formed partnerships and collaborations with all stakeholders at other hospitals, and started sharing our specifications, providing inputs to their tenders and their contract, and started creating awareness on sustainability within the health sector in the Western Cape, and bringing about commitment and community awareness as well. And we were always willing to learn from others, and also to draw from the other available resources as well, because this was a relatively new journey for us that we were taking as well. So then I will move on to our journey, the procurement journey itself, what we did and how we went about at St. George Hospital, what were the initiatives at the hospital. And then the journey thus far and the examples of innovative and environmentally sustainable innovations has been, first and foremost, was to build a sustainable procurement team at George Hospital. My team just looked at themselves as supply chain officials, and with the intention that we receive requests from our end users in the hospital, and we would go out, look at it for specifications, engage with the end users. Is this the correct product that we're looking at? And then we would test the market, and then we will go out on electronic procurement, and then we will procure the goods. And we then had to then build the very same team, but to change the dynamics of the team now. We then started looking at, if we're going to test the market on a product, we want to look at what does the packaging look like when it comes. We started requesting for samples because we wanted to see what the samples would look like, what your packaging looks like. Does your packaging include environmentally biodegradable material in it? We also started looking at the specifications to make sure that the products that we buy will be 100% biodegradable. We started also building, the team started building relationships with suppliers as well, because the suppliers also had great input into their packaging, into what happens once the goods are delivered, what goes into the landfill once our waste is removed. And then from there, we were able to move on to a very successful, sustainable procurement process, and started buying literally about 50% of our consumables, medical and surgical, we're now procured by the sustainable procurement way. And Thirdly, we also, the thing went about to procure, the department procured 3 hospitals a new machine. This was for managing the medical waste on site at the hospital. So prior to the procurement of this equipment, we had an outsourced service provider that came to the hospital, collected the medical waste from George Hospital, and then transported that medical waste all the way to Cape Town here to be disposed of. So 500 kilometers, think about the carbon footprint with the transportation of that medical waste. So we are fortunate enough to be one of the hospitals that acquired the Newster machine, and then the waste management was then managed on site, and then an outsourced service provider was appointed just to transport the waste, the waste, which was now literally almost like plastic, not even the size of my little finger. And this was then transported to Mossel Bay, that was only 50 kilometers away. So the medical waste made a great impact then on the environment, the transportation of it. We then went on to move and look at our hygiene contract. So the hygiene contract was consisting of air fresheners, furniture polish to clean the furniture within the office furniture within the hospital, our hand sanitizers, and we had to go and relook at that. So we were fortunate enough that our hygiene contract was coming to an end in 3 months' time when we started the journey. So I then teamed up with the Department of Environmental Affairs, and then we relooked at all the specifications, and then we went into incorporate sustainable procurement on that. We changed the specifications for the products to be environmentally friendly. We requested like you needed to have certificates from the South African Fragrance Association to ensure that the smell will not affect the patients, the smell won't affect the environment as well, the air freshener. We had to go look, we re-looked at the hand sanitizers, what was the composition of with it. We looked at the specifications of the packaging of the hand sanitizers came with the liquid itself, and would we be able to dispose of this packaging? Is it coming in plastics? How is it going to be disposed of? What would happen to the end packaging as well? And then we had great leadership opportunities as well. And because of the buy-in from the clinicians, we had an anesthetist then present the 1,000 days of anesthesia presentation across a forum as well internationally on how reducing the oxygen in theater will assist in saving the environment as well. And then this definitely had a significant reduction on our carbon footprint, our cost savings, and our sustainable waste management as well. And some of the things that we then moved on to do was to look at recycling within the hospital. We then went in to put in a service contract with an on-site recycling services throughout the hospital, right from main reception areas to support services offices to our outpatient clinics, within theaters, and to even in wards. We then had we had specific recycling boxes to identify where paper should be disposed of, where plastic should be, where the glass should go. So this was already separated. Now we had these displayed throughout the hospital with signs, which you would see in one of the pics later. And then normally with the disposal of our scrap material. So the hospitals, we go through a disposal process whereby when we have any condemned medical equipment assets, capital assets within the hospital, then we have a process whereby we would then, the Act clearly only allowed us the policy to bury this asset which is condemned or scrap it. And then we decided that we can find a way to get rid of our scrap material instead of burying this thing. And then we put in a contract to scrap the metal, whereby we had an outsourced service provider come in with the vehicle, with the crushing machine, and they would crush all the medical equipment that has been condemned, that was no longer required and disposed of, and then they would take it to a responsible landfill to dispose of it. We also collectively use a lot of batteries within the hospital. These are normal batteries as well as batteries that are used for the medical equipment as well. We had specific boxes placed around the hospital and for battery collection. And one of the rules was that if you want a battery, if you require batteries for any of your equipment or even for your air conditioning, then you would need to bring your old battery, and then only would you be provided with a new battery. That way we would ensure that the used batteries are not disposed of in an irresponsible manner. With regard to packaging, then, while we engaged with suppliers, we were fortunate enough to find 14 green suppliers within the Western Cape that the products came with packaging that would be 100% recyclable. With that was a very positive engagement for us, and we felt we were ready now to move on to change our specs to incorporate packaging that needs to be 100% recyclable once we put specification of our goods and services. So we also stopped using harmful chemicals within the hospital, because we were using that horrible boracic soap, and then we just replaced it with an alternative and environmentally friendly soap for the patients, because being a state hospital, we were providing the soap for the patients. And we changed all our cleaning products. All our cleaning products became biodegradable. So you can imagine that our cleaning tender for the hospital was around, the contract is with an outsourced service provider, and the contract is around plus minus 10 million rand for a 3-year contract. And we were quite fortunate enough then to work with the Department of Environmental Affairs, and then we changed specifications. The contract also came to an end, and our new contract kicked in with sustainability incorporated into it, with environmentally products as well. And I did allude to our new hygiene tender as well that we changed as well. So the other things that we started doing into the hospital was that we stopped using the 100% virgin plastic bags. We started only looking at recycled materials. And our renal dialysis patients, when they came for dialysis, things like that, when they were home with their medication, we were fortunate enough then to get the community to sew us reusable cloth bags. So now the renal patients would take their medication in cloth bags and go. The pharmacy, where when the patients were leaving and they collected their medication at pharmacy, their chronic medication, to go home, then the pharmacy were using the plastic bags, the bread plastic bag that are used for bread. These were collected in use. And then the pharmacy now changed to using brown paper bags, which were more environmentally friendly. And then we moved on to the lighting within the entire hospital. So the entire hospital then was changed, and we looked at replacing fluorescent lights with LED lights. So throughout the entire hospital, then the hospital is on low energy LED lights. So in the kitchen, then we replaced the polystyrene containers with sugarcane containers. So here we definitely had a challenge with regard to that, and we had to find a way to work around this, because the food services we use in the properly packed ready to serve patients, and then the industrial dishwasher broke down, and then the supply was not able to replace the parts to repair the dishwasher. And polystyrene containers were then purchased because one, the dishwasher was not working, and two, the staff were very, very unhappy within the food services component to wash dishes. Now they didn't want to wash the dishes, so that was a big challenge for us now. And then we decided that we didn't want to go, the hospital didn't want to go backwards now. We had made a commitment that throughout the hospital, we are going to incorporate sustainable things. So then we found an alternative, and then we went and we found sugarcane food containers. And then this was like, wow, this could work for us. So then we didn't continue using polystyrene containers, and then we procured sugarcane food containers. And the good thing was that we then procured a new dishwashing a dishwasher for the kitchen, and the sugarcane food containers could be washed as well, and also they are microwave safe as well and stuff. So that was very, very good news for us. And so these are, I just want to highlight, these are like, they may seem small in the beginning when institutions want to embark on the journey, but in the long run, you would look at these, it leads up to bigger things, and the impact that the small changes that you can make and the impact that it would have in the environment finally on it. And finally, we also looked at the local procurement, because for chicken, so all the groceries are procured via supply chain for the institution, and the chicken that we are buying, when we finally took the time to look at the packaging and read the finer details on the packaging, we were highly surprised to find that the chicken was imported. The chicken was not even local. It was not from South Africa. And then we made a decision that we will only buy proudly South African products and change to. So with that too, we had to change our specifications to our meat products in the kitchen. So these are just some of the pics that you will look at, that what we had. You will see that on the right-hand side, that was the borax. So you will look at the thing on my left-hand side, the material bag that the community wholeheartedly volunteered to sew, so that our patients could take their medication home. Our recycled boxes throughout the hospital. These were clearly labeled according to glass, paper, tin. And you will see the polystyrene containers that we used during the pandemic, because we did not have any other choice. So we found the sugarcane containers for us. So the other thing that we had to do was that we would not be able to take this journey by ourselves. We had to look at who do we engage with, and who would take our hand and walk this journey with us. And that's how we started engaging with the community and getting the community involved. So you will see that this thing on the 18th of July is Nelson Mandela Day in South Africa. And we would celebrate this whereby that you give off 65 seconds of your time. And then we, on this day to celebrate Mandela Day, the hospital extended an invite to the public to come. So there is a small river running alongside the hospital, on the border of the hospital fence. And beyond the river is a small forest with trees, everything. So this is an open field, and the river itself. So there are a lot of vagrants, there's a lot of dirt and plastics, and during the windy season, this will fly over the hospital fencing, and we had problems of that. So we went to the public, we marketed this together with the media, everything, and we had a cleanup of the hospital and the vacant grounds with the staff and the public. And then we also went to the beach to have a cleanup at the beach as well for all the plastic, everything which you see now on the slide. And then so we wanted the community of George to also know that we were taking their health seriously, and equally our environmental responsibilities that could impact on the health of our patients and the community of George as well. And we started to create awareness as well, because during the pandemic, with regard to the mask, we found a lot of the masks were just thrown. There was no responsible disposal of the mask and thing, and we started to look at millions of single-face use masks that are being thrown away and have this devastating impact on the planet. And last year alone, the stats showed that 1.5 million masks ended up in the oceans and landfills only in 2021 and stuff. So we had to urge people to start using redisposable masks and look at disposing of the mask and as well as reusable masks. So the hospital embarked on, the entire hospital went on to using cloth mask as soon as the pandemic started easing instead of the normal mask as well. So this was the cleaning up of the river and the park across in the forest. And you could see this is what we pulled out. This was the tons of waste that was just thrown across in the environment. And you can imagine then the impact of it. And we were fortunate enough, you would see right on the left-hand side, on my left-hand side, the First Lady. So that was Miss Planet. We invited her to become, to be part of the cleanup because this was creating awareness of the community. So we felt if we had somebody of stature and celebrity come join us in the cleanup, then definitely, it would definitely raise awareness in the community on waste and plastics in the environment. From the community, we then moved on to engage with our suppliers. And we decided to expand our remit now and to include our suppliers and manufacturers. And then we're fortunate enough, just before the pandemic struck in March 2020, I had a successful supplier open day with all our suppliers, and the response that I received was overwhelming. You would see from the pics, this is just half of the suppliers in our auditorium that we engaged with. And the engagement with them was me explaining the future journey of procurement and what George Hospital is embarking on and what we would like them to do and how they could go hand in hand with us. And they came with the expertise as well. They were in a position to provide inputs to us, to specification adaptations, because they were specialists in their fields as well. So the engagement continued, although it was a little bit difficult during the between the pandemic, the 2 years. But it was difficult to have face-to-face engagement with our suppliers because whilst the pandemic was on, it was locked down. Then, unfortunately, we had to. No suppliers were allowed to visit the hospital, but we started engaging on Zoom and on different various platforms so that we could continue to keep this robust engagements going as well. Yeah. Once we had supplier buy-in and stuff like that, we then decided to move on to engage with the staff, because now as much as we're speaking sustainability in the hospital, we're speaking environmentally product. We decided to see, let's get the feel of the staff at the hospital. Let's engage with them. Let's show them the products, and let's see how are we going to engage with them, what we're going to do. So then we started having, on a Friday morning, we started having staff engagement session, whereby every Friday we will decide on a specific commodity, and then the supply chain team, you will see, we will display the products, we will, and then we had a survey going with the staff, with the clinicians, with the nurses on the packaging and what would they feel about the packaging, because we definitely now going to start engaging with potential suppliers to change packaging, and how would they feel about it. So there was great enthusiasm and everybody was on board with regard to that. And we started generating staff enthusiasm as well. You would look on the right-hand side, whereby we even had green cupcakes, which we provided to the department that had collected the most waste for recycling with paper within the hospital. And that was a fair process. And this was one of my departments, the electronic medical records, that generated the most waste, surprisingly. And the team rewarded them with cupcakes. You will see that with regard to the pharmacy's staff started leading the way as well, and they became a recycling force within the hospital under the leadership of the pharmacy manager, and they started looking at various ways of how their medication was disposed, the packaging of the medication as well. And our newsletters as well within the hospital we started, you would see on my left-hand side, the George Hospital, we kept the momentum going. And every monthly newspaper, we would highlight our strategic priority of going green. And even with regard to the thing in the general wards, you will see below right that the nursing management. You see the second person on the right, that's a fellow from the UK that came to help us with the project where they were looking at the packaging of all the consumables that are used in the ICU with the drips and in the wards and stuff. So the awareness and the enthusiasm went hand in hand, and the staff were encouraged to reduce and recycle. And you can see that we ran various campaigns within the institution, and we were fortunate enough that all the staff embraced this and they wanted to participate. And we ran numerous competitions as well, just to get the momentum going and for us to continue further and not to stop on this and stuff. So the challenges, some of the challenges that we identified was that there were very few local suppliers. And one of the policies within the National Treasury for South Africa is that all suppliers need to be registered on the Supplier Evidence Bank and on the Western Cape Supplier database. And there were very few local suppliers that are registered on the database, and we would not be able to use them. So many of the times, all the consumables that we were procuring were being transported. Our suppliers were based in Gauteng, that is in another province, and in Cape Town. And so the impact that this was having, that we could not procure from local suppliers in order to reduce the carbon footprint, was definitely a big challenge for us. And then we took a drive, the hospital took a drive to go engage with our local suppliers in George and to encourage them and assist them to register on the database so that they would have an opportunity to bid for environmentally friendly products. And then the packaging, we at the beginning of the projects, we had not considered the packaging until we started engaging with our suppliers. And our food was not sourced locally as well as that we identified. We were importing the chicken, and we couldn't procure from local farmers. And the biggest challenge was that there was a limited understanding of the market. There was insufficient research, so we didn't know where to go to, and we started looking to engage then with institutions from other provinces that had within the Department of Health that had started this journey and had the expertise that could help us with that. And the takeaway, the lessons that we learned in things was that it needed a whole system approach. Supply chain practitioners couldn't do this by ourselves, and we couldn't do this as a hospital by itself. We needed stakeholder engagement, and communication was key. And change management, it's very rarely that people embrace change. It was difficult. We had to look at how we engage, how we communicate, how we bring about this change management. And the other takeaway was the sustainable practices to save costs, because as we went along, we were excited that we could buy environmental products, but we didn't go. As the finance manager, it was later on, the lesson learned for me was that we didn't do a total cost analysis, and we didn't look at doing a comparison between normal procurement products and environmental products, and what is the cost involved with this. And obviously the 2 years that we went on this journey, the impact of the pandemic, and the insufficient market research, and that we were fortunate enough with Google to look at finding what products are out there, even if it was international products and things like that, which we could then go and amend our specifications to align it to international standards as well. And then I think the biggest lesson that we learned, that if you looked at when I discussed the Public Finance Management Act and what we're governed by and the rigidness of it, the biggest lesson that came down to was the specifications. If we want to go forward, then all the specifications had to be realigned and stuff. And our journey so far and examples of innovative and environmental sets was, building the procurement teams and waste management on the site with the Newster machine, our cleaning and our hygiene tender. We went onto numerous platforms, this in showcasing case studies that we had come up with, and so that we can collaborate with others in the health field as well. And there were leadership opportunities. Terribly sorry. There were leadership opportunities as well, and with regard to that, and the collaboration with the different departments, such as the Department of Environmental Affairs and others. And I could say that the way forward now is that still looking at the leadership in the seeing opportunities, trying to intensify our commitment to green procurement and looking at the challenges and document the lessons learned, because these haven't been documented as yet. And we have started to share our case studies at different forums. We've been presenting at GGH forums. We've been presenting at Global Green and Healthy forums. We've been sharing specifications with other provinces as well, and building relationships that way, and in collaborations as well. And going forward, to definitely look at the cost analysis of normal procurement versus that. I'm so sorry about the phone. And I'll just find a way to put it up. And sorry, my apologies. And then the short-term versus the long-term effects of the pandemic on the organization's production. And then just building the network for economic growth. And then finally, I just wanted to go through the carbon footprint tool that we later incorporated in late 2022, whereby we went at George Hospital, was fortunate enough to be one of 3 institutions in South Africa chosen to pilot the carbon footprint tool and go about it. So then internationally, the stats showed that 71% of the emissions of the health sector came from supply chain. So then we went on then to measure this. The tool was very simple and easy to use that was provided. And it looked at, we had to go and look at what were the costs that we procured medical and surgical consumable. And then we looked at what was the carbon footprint. The tool showed us will reflect the percentage of it, then what supply chain, their carbon footprint, and we were highly surprised at what we looked at. And if you look at the total emissions per the different commodities within supply chain and what was the footprint, it emanated to 100% of it. And that was a serious concern for us with regard to that. And these were just looking at the scope of it, and the thing we looked at our electricity. We looked at the solid waste disposal, and we looked at supply chain. And in going forward, we were on the journey of starting in 2023, looking at the patient transport, where the HealthNet, the vehicles of the department are bringing patients in from the different districts and towns to George Hospital, and then also to start looking at employee commuting and employees using their cars, 1 person per vehicle coming into the hospital. And finally, then to look at the carbon footprint of business trips, whereby we use flights to fly from George to Cape Town, or George to another province within South Africa, and then to align these with the international climate objectives as well. So these were just the top 5 emitter categories that we looked at within George Hospital. And you can see the emissions were 64% for construction. That was all within the facility management, what we're busy with. And within our support services, the emissions were already at 35%. And we just looked at our business services, which was very relatively low. and then we would be taking it further with the other commodities as well and stuff. So as you can see, the construction, you just put it into 64% out of the 100% was a real concern to us. And then that brings me to the conclusion of my presentation. Thank you very much, Jenny.
Sharmane, thank you very much indeed for a very clear story of the journey. There is a question from Barbara, but before we do the question, I'm just going to let you know that we've got Gary Marshall on the call, who is actually head judge of the African Supply Chain Excellence Awards. And I know that he's extremely excited to see you on this call, Sharmane, and doing this presentation and sharing your story. So I'm going to call him up, but while Gary comes on the stage, and I've got over my stage fright, everybody. Barbara's question is, how have you maintained the commitment and momentum of your stakeholders to your green initiatives over time? And so I'm going to switch my camera off while you think about that response, and then Gary, over to you.
Thank you, Jen, and thank you, Sharmane, for sharing what is a really comprehensive and amazing story, and good afternoon to everybody else that's on the podcast. I can remember the first time we spoke here, Ms. Sharmane, and the sort of growth that you've experienced as an individual as a result of this process, I think, has been enormous. And I'm absolutely delighted that you've now got the opportunity to go on to, I don't know about better, but certainly bigger things. So well done. When we looked at this particular entry as a judging panel, you have to look at first of all, Sharmane tells this in a very unassuming kind of manner. When you have a look and you listen to every little step that was taken, every little thing that was done, there was almost nothing, no stone left unturned. And, the involvement. So procurement can be quite a dry subject, and I'm really sticking my neck out here. But Sharmane and the team at the hospital took this to the sort of nth degree, and involved suppliers, involved people inside of the hospital. And the story she tells of, people in the surgical, in the actual operating theatre, being involved in how they disposed of waste, to the local community, involving, even the mayor of the town and so on. I think all of these kind of things are just an amazing effort. So you can take a procurement exercise and then overlay it with everything that she's done, and it is an amazing story. I think too, Sharmane kind of just, because it's part of her world, she just skims through it. But she mentioned the Public Finance Act, and I forget the full sort of details of the act, but that makes it incredibly difficult for anybody to do business, and way, way more complex than private institutions who have basically corporate governance rules that they have to stick to, and of course legal rules. But this particular act makes everything doubly difficult. And so within the constraints of all of that, they delivered an amazing result. And I sincerely hope, Sharmane, that you are able to replicate this wherever you go. I know that for us, it was quite important to give this accolade as an encouragement to state or provincial enterprises, because, quite often one is led to believe that everything that goes in the state doesn't actually work. And here's an example of something that was amazing. So congratulations and thank you.
Thank you, Gary.
So Sharmane, have you got the answer to Barbara's question about how you're sustaining this commitment and momentum of the stakeholders?
So, Barbara, I think we were fortunate enough that this thing working. was at George Hospital for 10 years as the finance supply chain manager. And over that time, I had built that relationship with the suppliers, and not only with the suppliers, with the manufacturers as well. We're supplying things to the suppliers, and being fortunate enough to engage with them and building that relationship with them. After the open supply day, and then once the pandemic came and things had to stop, once travel was opened in 2022, then I went on to have a forum in Cape Town with all the suppliers within the Department of Health. So not only the suppliers that George Hospital was engaging with, but all the suppliers and manufacturers that the Department of Health within the Western Cape was engaging with. And at this forum, I also invited all the procurement specialists from the various hospitals, from district hospitals to regional hospitals to the tertiary hospitals as well. So that they had an opportunity to now look at this and start engaging with the suppliers, so that we all were common ground in at one spot, and we're able to do it. And to keep the momentum going, I think it's definitely communication and relation building, and in going forward as well, just to highlight the role of supply chain, and more often than not within the government facilities and stuff. We just said supply chain is just this back office somewhere in the back of a hospital, and all you do is just you get requests, and you need this product, and you expect it to buy it and stuff. And so with this, to keep the momentum going and stuff, to just to continue speaking about sustainability, continue speaking about the impact that supply chain has, continue speaking about the impact that what the hospitals does have an impact on the community. What the community does has an impact on the hospital, because whatever happens on the outside of the community then has an impact on the patient and will increase patient numbers through the doors and stuff. So it's a circle, it's ongoing, it won't stop. And I think, so just continuing with that momentum, engaging, collaborating, networking, and communication.
Well done. Brilliant. Brilliant, brilliant. Sharmane, thank you so much. And thank you, everybody. Gary, thank you for your neat summary there of why we were so excited about this particular submission, and delighted to be able to recognize it. And Sharmane, for you doing the presentation. I think that's been a terrific end to a new beginning for this project. And thank you again for your time and your efforts. It's been really, really great. And your final answer, Barbara was saying, thank you very much for your final answer. It was a great way to end the presentation. So onwards and upwards, everybody. Don't forget to enter. If you do have a story to tell us, please tell us. You can always just give us a quick idea if you're not confident about it. We'll tell you whether we think it's got legs or not. But really, our intention is to highlight the brilliant work that's being done in Africa. There's not enough recognition of it. And I think that, to that end, that's what we want to achieve. So thank you for joining us on this journey. And thanks again, Sharmane. Take care, everybody.
Thanks, Jenny. Thank you, everyone. Bye-bye.